This is the All One Nurse podcast, where we are bridging the gap between the stethoscope and the soul and getting back to the human side of healthcare.
Powered by Riverside.
Welcome to the All One Nurse podcast, where I'm your host, Nurse Chanel, and I have a wonderful speaker here with me today, Dr. Ashanti Coleman. Welcome, Dr. Coleman.
Thank you. Thank you for having me. I appreciate it.
Yes, thank you for being on this episode of All One Nurse. It is an honor to have you here on this platform because you have published your own work with Tennessee Nursing Association and been featured in the Memphis Voyager, Canvas Rebel, Memphis Memphis Health and Fitness, and the Business Insider, which we will find out why in this episode of All One Nurse. So welcome. Before we start this conversation, I kindly ask my listener, yes, you, my listener, to open up your hearts to receive this impactful information that we are about to discuss. We will be delving into Dr. Coleman's world, including her professional journey, her background story, challenges, motivation, patient perspective, educational insights, and experience as a two-time stroke survivor in her 30s. We'll also explore Dr. Coleman's entrepreneurial ventures, such as her 929 apparel and Rejuvenate 901 clinic. Stick around as we have a lot to uncover here, and you will also find out how you can connect with Dr. Coleman and her awesome services. And with me, your host, Nurse Chanel, here after this episode to keep the conversation going. So, Dr. Coleman, how are you?
I am well. How are you?
I'm doing good. I'm just excited to have you here.
I'm excited to be here. I honestly am. I love this.
Yes. So, getting right to it. Tell us about you. Who are you? What's your origin story?
My origin story. Oh gosh. I am the third child from both of my parents, which is ironic. My dad has 10 children. My mom has
Oh,
4, and
wow.
I'm the third from both
Okay.
parents. I was originally born in Toledo, Ohio, spent first 10 years there, and then we moved to Illinois and spent the remainder of my life there, where I met my high school sweetheart and married
Mhm.
him, and we moved to Memphis, Tennessee.
Okay.
Had our rainbow baby. Our oldest is 19 years old, and then our youngest is 15. Well, she'll be 19 in September. I'm upping her age already.
Okay.
So we just had our oldest graduate from high school, and I'm just like not still in awe about
Yes.
her graduating because it's just that time flew by. I started my journey in healthcare actually as a unit secretary. I knew I
Okay.
wanted to become a nurse, but at the time that I was trying to get into nursing school, there was like 10-year waiting lists.
Mhm.
Very frustrating. I had been to multiple schools for different things that they were offering as far as informationals about the programs. And I was actually headed to one particular school, community college in Illinois. And I was looking into radiology. I knew I wanted to do something in
Mhm.
medical. I knew
Mhm.
nursing was my first choice, but with a 10-year waiting list, I just was like, okay, well, I got to get into the medical profession
Yes.
some kind of way. On the way to the college, I just felt defeated. I mean, I had went to the informational, just like, still the same information. It's 10-year waiting list. I'm like, oh my God, just please tell me what you
Mm.
want me to do. Tell me. I literally just show
Yeah.
me a sign, and that was the clearest sign I had ever gotten in my life to date. We were on the highway, and there was a car in front of us, and literally the license plate said "Hello RN." I kid you
Wow.
not. And 10
Wow.
years, it literally did take me 10 years to finish school, which
Wow.
I was considered a non-traditional student because
Mhm.
by the time I got in school, all that time I was trying to get in school, I had no children. So God was being very
Wow.
funny when I did get into nursing school in Memphis, Tennessee. I actually remember calling University of Memphis
Mhm.
to see about the requirements. And the lady on the line told me, she asked me what my grades were in certain courses.
Mhm.
And so I did explain to her, I did have some C's on my transcripts, and she told me I would never get into their nursing program with those type of grades. Yes.
Wow.
So I tried anyway. I
Mhm.
applied anyway. I applied to the University of Memphis. Said, okay, God, this is the last time. I'm not doing this anymore. I'm gonna try University of Memphis, and then I applied at UT Dental Hygiene, and I'm like,
Mhm.
whichever one you put me in, God, that's where I'm gonna go. That's where I'm gonna
Yeah.
take me. I had my son, my youngest, in 2009 of February. 2 weeks
Mhm.
after he was born, I literally was sitting there nursing him. My husband brought the mail in. I had an acceptance letter from the University of Memphis.
Ah,
Lo and behold, I
yes.
still have that acceptance letter. I kept it because I thrive off people telling me I can't do something. So
Mm.
that is my motivation. That letter was signed by the same individual that told me I would never be in their program.
Stop.
So I still have that. I can literally put my hands on that letter to this day. So I use that
Wow.
as motivation, a few. But that's how I started as a unit secretary. I became a nurse extern and then worked my way through to become a registered nurse and then transitioning into a nurse practitioner. I did not take a break in between BSN and my MSN. I
Mhm.
knew I was an older student and I knew that was my ultimate
Mm.
goal at that time was
Got you.
becoming a nurse practitioner. So I finished school in 2012 at University of Memphis.
Mhm.
My husband got promoted. We ended up moving to Detroit. So spent about 2 years there, and all the while I was networking. I was creating relationships to identify my preceptors. I was in
Mhm.
school, so I
Got you.
finished boards July of 2012, enrolled in NP school September 2012, and I
Oh
graduated
wow.
from NP school May of 2016. And I was done. I was
Wow.
like, I am not going back. I have literally been in school all my kids' lives. And I told you
Mhm.
when I started undergrad, I had an infant and a toddler.
Mhm.
So that was rough, and it's like everyone there's anyone that's been through nursing school knows
Yeah.
how difficult it is. But with that combined was very difficult. And my
Yes.
husband worked crazy jobs, like not crazy jobs, but a crazy shift. He worked for
Yeah.
a railroad. So literally, we would be swapping out kids in the parking lot so I could go run
Oh
upstairs
wow.
to be on time for clinicals. That was
Wow.
like, yeah. And at that
Like,
time, we had no family to help us, so it was just me and
oh
him against the
wow.
world, literally.
And that was going to be my
So
next question. Like,
go
where do you find
ahead.
time? Where do you find time to rest? Like, y'all didn't even have any time, but
We
y'all
did
endured.
not. We endured. We knew it was an
Yeah.
ultimate. We've always worked well together,
Mhm.
and because of our track record of being together for so long, we knew what each other's goals were, and
Mhm.
so he kind of laid low and worked while I got through school. And
Mhm.
during our time with graduate school, we were boyfriend and graduate school at the same time. We actually
Mhm.
graduated at the same time. So he
Oh
graduated.
wow.
He graduated in May. I think I walked in like June or July of
Okay.
2016. We got our master's degree. So at one point in time, we weren't in school together, and we made it work
Wow.
with the grace of God. And then, of course, just knowing what each other's goals were and getting through that. At that time, I had no desire to go back to school, but I
Mm.
had a medical situation occur, and
Mhm.
that is what prompted me to go back and get my doctoral degree. That's okay.
That was very inspiring. You made it work and you didn't give up and
No.
you still went on to get through school even with children.
Hmm.
But I think that's having a good support. You and your
Absolutely.
spouse being a good support, that just says a lot and that speaks volumes. What would you say one of your biggest challenges were coming through nursing school, like from degree to degree, especially
From
your
the
BSN to your MSN? What would you say your biggest
My
challenge was?
biggest challenge, I think balancing wife, mother. I think that, and still, I still have that mom guilt because there were
Mm.
times that I literally, my youngest child in undergrad, I spent his first birthday. I had books at Chuck E. Cheese. I was studying for an exam, like
Gotcha.
literally, like
Yeah.
my birthday, my big
Mhm.
30th birthday, I was studying. Like I didn't get to enjoy some of those things. I had to miss out on things. So a lot of that mom guilt and even not being able to do things with my husband. So we try to make up for it now.
Got you, got you. How do you feel like when you went from BSN to MSN? Did you also work at
Hmm.
the bedside? Um,
Yes, I did. Yes, I started off in it ER, which that was not
mhm,
my choice. I wanted to go into L&D, but
okay.
nursing has a lot of gatekeeping.
Mhm.
That's the word I'm looking for. There's
Yes.
a lot of gatekeeping in nursing. I just knew I wanted to be an L&D nurse, but I never could get into it. So I started off in the ER, which is crazy because you would think the ER is more complex than L&D.
Mm-hmm.
But they took me in L&D, and then from there I transitioned to dialysis, urgent care, and then I was a float pool for outpatient clinics, and that's how I worked my way to networking with different doctors
Mm-hmm.
to create my preceptors. Because in graduate school, you do have to find your identify
Right,
your own
right.
preceptor. And I'm huge on network. Anyone that knows me knows
Mm-hmm.
that I am a big networker. Like I connect people. I find
Yes.
ways to get, yeah. So yes, working. I worked part time while I went to school part time. I was
Mm-hmm.
like, for graduate school, I wanted to still have some quality of life, considering I had just went through
Mm-hmm.
a tedious undergrad program. So I still want to have some kind of quality of life. I feel like I was able to accomplish that by
Mm-hmm.
doing part time. So it took me 3 years to finish the program
Mm-hmm.
as opposed to two, and I
Got
was
you.
okay with that. So
Got you.
yeah, and then like I said, me and my husband came out together, so it was pretty cool and fun. I still have our caps with our tassels in
Mm-hmm.
hanging up in the living room because we both graduated. That was a big thing for us. We came out together. So
Got you. Now, and this was your master's, right?
mhm,
And then what
mhm.
did he get his degree in, if you don't mind me asking?
MBA. He has an MBA.
Business.
Mhm,
Okay.
mhm,
Got you.
mhm.
Got you.
Yeah, he's a transportation logistics business person,
Okay.
and that's how we work so well together in the clinic because
Mhm.
he has that component. So
Okay. Got you. Oh, y'all just a good duo. Just a power duo. I love it. Now, what would you
thank
say your
you.
your biggest motivation is? Like what motivates you
What
from day to
motivates
day?
me from day to day, my kids, my family,
Mm-hmm.
definitely my children, my husband, and
Mm-hmm.
honestly, naysayers. I use
Got
that as few, and I instill down to my kids. Please tell me I can't do something, or I'm not going to get it done, and I'm going to find 10 different ways to do it, and I'm going to
yeah.
show you the 10 different ways I got it done. You're going to be scratching
Oh
your head like,
wow.
man, I probably shouldn't have told her that.
Yeah.
Yes, that is a
Yes.
really big thing for me. Like, please tell me I cannot do something or I'm not going to get it done because it's gonna happen.
You are such a go-getter. You are such a go-getter, and I admire
Thank
it.
you,
I think
thank
for
you.
me, my motivation has been lately is just having a made up mind.
Yes,
Having a made up
absolutely.
mind, and
Uh,
I've been quite the opposite. If somebody say, "Well, how about you do this?" and I'm like, why should I do that? Or, I
hmm
don't do that, and I'm like, well, why don't I do that? So it's like,
Absolutely,
go for it.
absolutely.
Don't be
Yes,
afraid, and have my
I
mind
a
made
lot of
up.
that I get it from both my parents. My mother she's one of eight that was the
Mhm.
only one that graduated with her college degree. That grew up in the projects in Chicago, and she was a teen mom, but she
Mhm.
got a college degree. The only one of my grandmother's eight children. My father was a Black Panther, and he actually was a
Okay.
bodyguard for Fred
Wow.
Hampton. So I
Wow.
have the militance and the tenacity and the go getter come from a combination of both
Mhm.
of my parents.
Yes. Oh, so inspiring and motivational. Like I see you as the person where if I'm trying to get motivated, don't come to you. I need to be already motivated before I approach you about
I know I'm gonna
anything.
now. Even if you're not motivated, I feel like I can still help motivate. Even with my students,
yeah.
they get worn down. They come
Mm-hmm.
from different walks of life, and I enjoy instilling that into them as well. Just like my kids. My son came home one day and was like, "Mom, I'm eighth grade. I'm not gonna learn all these states and capitals." And I'm like, "Why aren't you?
Yeah.
Why can't you?" And
Yeah.
when he saw that he did it, I still use that story today to help him through
Mm-hmm.
difficult things where he thinks like now he's preparing to drive. It's like, I'm not going to get my life. Why not? Sir,
Right.
yes, yes. Remember
Challenge
that
them.
time when, yeah, so
Yeah. That's good. Now you mentioned students, so tell me what you're doing now with students.
teaching. I absolutely love teaching. I love giving back because people's poured into me. So And we're honestly, you're not going to be able to be in your position forever. You have to pass the
Right.
torch. I ran track, I coached track, and that's what it reminds me of, running a relay. When you're running that relay
Yes.
race, you can only run it for so long. You have to
Mm-hmm.
pass that baton to the, so it's passing it down to the next generation of nursing leaders and nursing
Yes.
professionals.
Yes.
And end of the day, even with my medical condition that I had, my situation, and just in general, I have older parents, I have children, myself. When I seek
Mm-hmm.
healthcare, I want to be able to look up from the bed and see that there's a good healthcare professional taking care of me. And if I know
Yes.
that it was one of my students that I taught, I know for a
Yeah.
fact, oh yeah, I'm in good
You're
hands.
good. Yeah.
So
Yeah.
I have, that's why I tell people I'm selfish when it comes to teaching. Also, yes, I
Mm-hmm.
have an ulterior motive for you to be a great a great nurse, so
Yeah.
that you could take care of me and my family and your family as well. So yes, I'm selfish. I want you to be a great nurse for those
Yes.
reasons.
Oh, that's good. Yes. Now, what group of students are you teaching right now in nursing school? Like,
Currently, I have two schools that I'm teaching at. I have TCAT, Tennessee College of Applied Technology. I teach the senior LPN students, which
okay.
this is a great time to be teaching them, because I'm not picky about what type of nursing students I teach. I don't care if it's
Right.
undergrad, graduate level, because I've taught across curriculum at some point. I've taught both at the same time, undergrad and graduate. It's a great time for the LPN students because they're reintroducing them back to the bedside in many
Yeah.
of the hospitals here, which I think is amazing. We honestly never should have phased them out, in
Right.
my opinion.
Yeah.
But introducing them back to the bedside, specifically in a hospital setting, is great. And when I started taking the students, they were so motivated, so enthusiastic, so
Mm-hmm.
excited to be in that environment, just pumped up and just ready to go and eager to learn. So it was refreshing because I had never taught LPNs before. This was my first time. But of course, being a teacher in
Mm-hmm.
general of nursing students, it was awesome to be a part of that. And they were the first set of students at this particular hospital. So we kind of like made history in a sense.
Yes.
So it was really good. And then I also teach graduate NP students at Arkansas State University. And a lot of
Okay.
that is mostly online. So
That's my stomping ground. That's where I got
is
my
it?
BS in. Yeah, in
Okay.
2011. Yep, Arkansas State.
Okay.
Yes. Well, I think that's awesome, even with the LPN students. And I have plenty of staff that come into my place of employment and they always ask because they're not nurses, but they say, well, how do I get into nursing school, or what's your thoughts? And I'm like, whatever works for you. You have the
Mm-hmm.
LPN program, and I say start wherever it makes sense for you, whether it's an
Absolutely.
LPN program, because you can continue to build from there. And so
Absolutely.
I think that's awesome. Thank you
Yes.
for
And you're
sharing
still a
that.
nurse. Yes,
Yep, still a
absolutely.
nurse. And I said we
Mm-hmm.
all work as a team, even from my patient care assistants or nursing assistants. I said we
Mm-hmm.
are a team from the provider all
Absolutely.
the way down to the patient care assistant. We are a team and we all need to work together for safe patient care. And so,
Yes, ma'am.
I tell myself I love people, and that includes us in every
Mm-hmm.
role, even from there to housekeeping, because we have to have
Absolutely.
cleanliness in order to maintain health
Absolutely.
in a hospital setting.
Absolutely.
So thank you for sharing that.
Absolutely.
Now, we've kind of talked about your motivation and your
Mm-hmm.
challenges. What has been your most complex challenge that you've had to overcome?
To date, my most complex challenge that I've had to overcome was assisting my daughter through the CNA program in high school. She
Mm-hmm.
has an invisible learning disability. So she has a learning disability, and she's had one since she was 4 years of age, where she has difficulty processing information. She can learn anything. It just takes
Right.
her a little bit longer to grasp the information. But her getting through that program was like amazing. Her
Yes.
confidence went through the roof, and it was just, even my
Yes.
husband, my son was like, man, mommy, you helped her do that. That was just so
Yes.
great. Like, she wants to give up, I want to
Mm-hmm.
give up. Like, I would literally was exhausted because
Yeah.
I would teach at school all day, come
Yeah.
home, and I feel like I was in nursing school again because I'm teaching
Mm-hmm.
her. And I am nurturing, but I'm not. I think I'm more of a tough love type.
Mm-hmm.
Okay, so we gonna do this. We're gonna do this.
Yeah.
Okay, I am more of a tough love type
Yeah.
person with a little bit of nurturing mixed in there, but more on the tough love side.
Mm-hmm.
So it was times when it would be grueling at that table at night, and my husband and my son would be like, "Man, just let her quit, mom. Just let, just let her
No,
drop out the program." I'm like, "No, we
we
don't
not
quit.
doing
We
that. Yeah.
no, we're not doing that. We're getting through this."
Right.
And she presented to us. The high school has so many different areas the kids can go into, which is awesome. She
Mm-hmm.
originally was going to do culinary, but she came to us one day and was
Mm-hmm.
like, I want to do nursing. I never tried to put nursing
Oh,
on my children. I want them to
got
make
you.
the decision for themselves. So when
Got
she
you.
said nursing, I perked. I'm like, okay, yes, come join
Yeah.
mommy. Yes, we will do nursing. And
Yeah.
honestly, she is the reason why we opened our clinic. I
Wow.
want to provide employment
Yes.
for her and as well eventually for other people
Mm-hmm.
too. But for my children to have generational wealth and
Yes.
for specifically our
Come
daughter
on.
to have a safe place to be nurtured and
Yeah.
groomed to work in healthcare. So
Yes.
she honestly was one of the bigger factors of us opening
Oh
the clinic.
wow. Awesome. And now tell me about the clinic. When did you open Rejuvenate 901?
So Rejuvenate 901 opened in March of 2023. And like I said, she was one of the factors, primary thing that got me to saying, I'm about to open my own clinic. I got COVID. I got
Oh,
COVID and I was in the bed sick, and that was my second time getting COVID. But I reached out to my director and told her, "Hey, I have COVID. I'm not well." So I couldn't come on campus. I couldn't do anything with the students.
mm,
And honestly, I felt like crap. Like it was worse than the first time. So this director called me and was like, yeah, I saw that you said that you have COVID. I'm sorry you're not well, but I need you to put those grades in. So
oh
that did it for
wow.
me. So I was like, okay, you're a nurse practitioner yourself and you have no compassion at all because I'm a stroke survivor.
Yeah.
You don't know what COVID, even if I wasn't, you don't know
Right.
what COVID, you didn't bother that. If, am I in the hospital? You
Mm-hmm.
don't know what's going on with me. So then that was that little motivational spark that struck me, and I started writing
Mm-hmm.
my book. I came up with my name of my clinic, the colors
Wow.
of the clinic,
Okay.
and the services we were going to offer. I said, you know what? No, we're not doing this anymore.
Wow. Wow.
So that was the stepping stone, and then my daughter getting
Mm-hmm.
in the CNA program was another component of it. And then
Okay.
the services that we offer, I like holistic things. I like natural things because I'm limited in some of the things that I can get as I age. So
Mm-hmm.
I want to offer some of those things to the general public as well.
Got you. Now, before we dive into the details of Rejuvenate 901, let's backtrack
Hmm.
because you said you got
Okay,
COVID twice, but
I got COVID twice.
after after you had your stroke, and so tell let's backtrack to that time.
The
Around what time?
stroke.
Yes, your first
Okay,
stroke. Let's
okay,
backtrack to that and tell me more about that. Tell us more about that.
okay. So my first stroke was 2017. I'm trying to remember. 2017, yes. In all transparency, I had just gotten laid off from a job. My husband had just gotten laid off. We were both super stressed in a
Okay.
sense. And we actually were in a very heated argument about finances because of the situation.
Wow.
When my stroke occurred, literally, like in the midst of me still trying to argue with this man, I'm having a full
Wow.
fledged stroke. And
Oh.
I recognize the symptoms. He's recognized something is not right, and he's trying to tell me, "Hey, something." I'm like, "Don't worry about me. I'm still gonna win this argument." In the
Jesus.
midst of having this, right? Exactly. So the day before I was running on the treadmill. I had just lost like 16 pounds. I was feeling
Mm-hmm.
great. Besides, I thought of the stress component from the finances. Um, we were just having that heated discussion. I had woke up with a headache that morning, just on the right side of my head, just throbbing. I'm like, okay. I generally don't take medications. That's not me. I don't like to take. If I don't have to, I don't take them. I'd rather just
Right.
be in pain, just stick it out. Went to Starbucks, got some Starbucks, dropped the kids off at school, came back, and we were having this discussion, and my
Wow.
speech started getting slurred. Well, I had a numbness and tingling run down my left side of my arm
Mm-hmm.
first. Speech got garbled. And then he's like, wait a minute, I'm trying to walk off from him. He's like, yeah, something is not right. And then My
Wow.
coordination, my legs went. I couldn't walk anymore. And so I'm on the phone trying to call 911 with this garbled speech, and he had to take the phone from me and tell the lady, "Yeah, I think she's having a seizure." I'm like, "I'm still garbled speech." "No, I'm not having a seizure. I'm having a stroke." And so the ambulance came, worked me up, got me to the hospital, and sure enough, they found that I had a clot in my brain on the right side of my brain. Did a complete full-fledged workup. Could not figure out why did this healthy 38-year-old have a stroke. I don't eat beef, pork. I don't smoke. I don't drink. So I was fairly fit. They could not figure out. Well, a month prior, I had switched to a new birth control,
Mm.
and that's the only thing that they could have contributed it to was the birth control pills. That was the only thing. There was nothing else. Literally worked me up for everything. They did
Wow.
try to get the clot out of my brain. They went and
Mm-hmm.
through my groin and tried to remove it, but it was too small. So they went ahead and did the TPA,
Okay.
and it resolved. I had residual. I spent 2 weeks in ICU, then 2 weeks in neuro med surge, and then I went to a week in ICU, a week in neuro med surge, and then I did another week or so in inpatient rehab.
Okay.
And this was right around Thanksgiving. I was very determined to get home for Thanksgiving. I was so
Mm-hmm.
ready to just be back home with my kids and my family. So I worked super hard in rehab. I had speech, occupational, and PT. Really didn't have any residual. I was
Wow.
able to walk fine. No issues with that. The closet on my right side, so my left hand I could not use. I could not open and close. I couldn't do anything with my left hand. I couldn't button up my pants. I couldn't comb my hair, anything
Oh,
like that.
wow.
And then I had the left sided weakness, so difficulty talk. I could talk. I had a thick accent. I had a Jamaican accent for 6 months.
Wow.
And had never been to Jamaica prior to that. And then actually,
Wow.
when I researched that, that is a real. It's called FAS, foreign accent syndromes. It's some people their brains rewire,
Wow.
and some people can have a British accent. Mine was Jamaican, to the point where my
Wow.
speech therapist asked me, "Where are you from?" And I'm like, "I'm from Chicago." So it was, yeah.
Wow.
So I did
Wow.
therapy so that I could get home, and then I had a couple months of outpatient speech, and
Mm-hmm.
then that's when I started teaching. Was that January I started teaching? But yeah,
So,
that was the road. Yeah,
so wait a minute. So with the first stroke and with the TPA, so since they gave you the TPA, which is like a clot buster,
Buster.
right? Did you immediately regain the the mobility in your legs after
So
the
the
TPA or
Yes, I did. And then my vision was off also, because I remember, it's sad, but I laugh about how humor is my therapy. I
mm-hmm.
remember being on my phone because I remember I said we had lost jobs. I was applying for jobs from my phone on Indeed in the ICU. I could not see. My vision was off. So I was seeing double, so yeah. So my vision, I regained my vision back because I'm trying to text people and I
Ma'am,
can't see. Yeah.
ma'am, why was you
Mm-hmm.
applying for jobs as a patient in
Cause
the
I'm like,
ICU?
we have to work. Like,
Oh
we
my
got to get jobs.
God.
We got kids to feed. We live in this big house. We got to pay for it. Like that. That
Yeah.
has always been me. I don't know. So yeah, I'm in the hospital applying for jobs. Literally in the ICU applying for. Yes.
And realized your vision was off too. Dr.
Yeah.
Coleman, you are Miss
So,
Go Getter.
but the
Dr. Go
TPA,
Getter.
right? The TPA did help. It did help. And then from there, I just improved. My accent went away
Mm-hmm.
after 6 months, just miraculously.
Okay.
I should have recorded myself so I had something to go back and reflect on. But my students were like, "Oh my God, I'm not gonna be able to understand this lady. She got a thick accent," and it just went away. So I
Got
think it was
you.
just because I was trying so hard to enunciate my words and not
Mm-hmm.
sound like I had slurred speech, that it was coming off like Jamaican accent.
Got you. Got you.
Hmm.
Well, thank you for sharing that. Now, like I said in my introduction, you are a two-time stroke
Hmm.
survivor. So tell us more about that. What
So the
happened the
second
second
the
time?
second incident actually was a TIA with a twist to it. So I had
Okay.
similar symptoms. I had been having a nagging headache on the right side, just like before. So I'm like, let me go back.
Mm-hmm.
I finally went to the hospital after I was trying to just a week of just, having this nagging headache and taking things and nothing resolving it. So I said, let me go back to the hospital I went to before. They have all my records, they know I'm a stroke survivor or previously had a stroke. Went there, ER was popping. I literally sat
Mm-hmm.
for almost 6 hours before I got. I mean, they triaged me, sent me back out there, looked at looked at my old CT. Of course, that my it's gonna show they did a CT, but it's just gonna show old infarct, right? So they finally get me back to the room. The nurse that comes in actually graduated from the school that I had been teaching at, because I'm conversing with her, and she's just
Mm-hmm.
like, they're going to admit you. She never did an assessment of me, never put a stethoscope to my chest, never did a neural exam, nothing. They're going to admit you. Okay, well, why are they admitting me? Well, they're thinking it's a TIA and they want to admit you for observation. Okay, fine, cool. Go ahead and admit me. And in the midst
Mm-hmm.
of all that, I'm like, my symptoms are getting worse. So I ended up spending, this is around Cinco de Mayo
Mm-hmm.
2017. I ended up spending about 4 or 5 days in the hospital, that particular hospital. And no IV fluids, never got IV. You didn't even try to abort the headache I'm having. I'm saying my symptoms are getting worse. My head is just all on this side, just hurting.
Wow.
I told my husband, I said, I just want to take my head off and set it on the table. It hurts so bad. And so the neurologist that saw me when I had my first stroke came
Mm-hmm.
back again, and he came and he was like, well, you're just having migraines. I was like, I'm not having migraines. It's something different. I had to advocate for myself to get pain medicine. Again, I don't take medication. So it was so bad to the point where my husband turned and looked at me once the doctors were going. He was like, are you sure you're in pain? I said, I promise I'm hurting. I'm telling you, I'm in pain. So at this point, my husband's doubting me. The doctors are not believing me. The nurses are not advocating for me. And at the time, I had my really good friend was my primary care provider, and she was
Mm-hmm.
actually off duty, but she was monitoring everything from afar. And she was like,
Mm-hmm.
yeah, you probably need to go to another hospital, because
Mm-hmm.
I don't understand why they're getting ready to, they were getting ready to discharge me. So she asked the doctor, why are you discharging her? Because she's not better. You're not fixing anything.
Mm-hmm.
It's like, she's still in pain. And he said, she doesn't look like she's in pain. And she doesn't meet criteria for us to keep her. So she told me, go to another hospital. Not a problem. So some people were wishing me well, wishes get
Mm-hmm.
well, but on social media. And one of my friends who is a nurse saw it. She's a neurologist, NP, and she was like, hey, what's going on? So I called her, talked to her, told her what was going on. She was like, hey, if you're not better by tomorrow morning, come down to our hospital, because we specialize.
Mm-hmm.
I'm trying not to say hospital names,
Right, right.
because we specialize in what and what's going on with
Mm-hmm.
you. So I said, okay, fine. Went home, went to bed, woke up in the middle of the night with excruciating like pain and like a tearing sensation in my neck.
Oh my God.
Go to that hospital. Meanwhile, everything, I'm getting numbness and tingling down. Everything's getting worse. It's worsening. My
Mm.
vision, everything. My friend drives me to the hospital and they work me up. And the ER doctor used to be a teacher. And I looked at him. I said, "Do you believe it's something is wrong with me?" He said, "My job is, yes, to believe something is wrong with you, and I'm working you up for the worst case scenario, and we're gonna work our way down from there." They ended up doing they did every scan, and in addition to a Doppler. They did a Doppler, which the other hospital did not do. And when they did that Doppler, they found that I had a 50% blockage in my right carotid artery, and it was torn. So
Wow.
that's why I was having those. I ended up having an emergency endarterectomy
Mm-hmm.
within 24 hours, which repaired instantly. Like when I had the surgery, my headaches were gone.
Right. And so in the endarterectomy is where they go into the carotid artery and
Hmm.
they remove that clot, right?
Yes, they
And
removed the junk, all the plaque. The doctor told me I had so much gunk in my artery. It looked like it belonged to an artery of a older fat man.
wow. Wow. Did you have any history of like high cholesterol, or did we think that
No,
some of your same factors kind of put you at risk for it? The
no
birth.
history of high cholesterol, but what was speculated was when I had my first stroke and they tried to do the thrombectomy,
Oh, yeah,
they ruptured my artery and it created a flap.
yeah,
And
yeah, yeah. That makes sense. That makes
hmm
sense because the body tries to repair itself. So then
yes,
you have
absolutely.
platelets, and they all collect there, and but
Hmm
they narrow that
Yep,
vessel. So same way with
absolutely.
cardiac disease. Same
Yep,
with cardiac disease. Okay. Whew, that's a story, Dr. Ashanti. Well, it's the
I know.
truth, but
It,
Dr. Ashanti, oh my Lord. How long did you stay in the hospital after the endarterectomy? And was the recovery different because it was immediately like the symptoms were immediately like resolved?
I stayed in, I think, 2 days. And it's so
Okay.
funny because I was getting ready. I don't know, a job always has something to do with me being in the hospital. I was getting ready to start a new job. And I had
Okay.
accepted the position. I had to call them. I literally called them boohoo crying, like, I have to have emergency surgery. And they were so
Mhm.
sweet. They waited on me. They sent me flowers to the hospital. And they were like, we will wait on you when you get, just take your time, recover, and we'll be
Yes.
here when you. And that was so awesome. But yes, recovery was like 2 days. He actually was trying to, the neurosurgeon was amazing. He was actually trying to
Hmm.
kick me out before then. I was like, nope, I don't feel comfortable going home yet. Give me one more day.
Yes.
So yeah,
Yes.
recovery was great. I was, I don't, can't see my scar anymore. I call it my
Hmm.
war mark,
You're
but
one
I
more.
had a scar.
Yeah.
I had a scar for the longest, and I was so self conscious about it. But that's the reason I'm
Hmm.
alive. So,
Amen.
but
Because that's a medical emergency.
absolutely,
Whew.
absolutely,
A stroke itself is a medical
yeah,
emergency. So with a dissecting carotid artery, you are definitely a walking miracle to
yes,
even
and
survive to tell the
absolutely.
story.
And being a patient, and the funny thing is, they knew I was a nurse practitioner too when I
Hmm.
came into the very first hospital that dismissed me as migraines. They didn't care. In
Ah.
my opinion, all I saw was a black woman who said they were in pain, and because I was not cussing and fussing and crying, and I
Hmm.
was still functioning and on my cell phone, and you're not
Hmm.
hurting. But
Wow.
we learned that in nursing 101, pain is whatever the patient says
Yep.
it is.
It's the patient's perception. I remember asking you when I ran into you to even get to this opportunity to interview you. I asked you, what was your one word? If you could tell me one word for why you do what you do. And you told me
Hmm
advocacy. And so I
hmm
think that is just so awesome. So
Yes.
awesome. And then to be a go getter, because you are my go getter, to be a go getter and to do it in a way that you're providing safe patient care, and you're
Absolutely.
advocating for patients. Not only through taking care of patients yourself, because I don't know if you explained it, but you are a nurse practitioner. You're certified in family practice.
hmm
Am I correct? And so
Correct.
to advocate for patients that you have of your own and to do so on the side of nursing because you're an instructor, that just speaks
Right.
volumes that you're doing it from both sides.
Absolutely.
Both. I got to do a year with nursing students, and I
hmm
just wanted them to see, especially in clinicals, you may have one patient because they had to do their workup for their one patient, but I
Right.
have all of your patients. You're working up under my
hmm
license, and so I
hmm
want you to take that initiative to go learn everything about that patient. And if you don't
Absolutely.
understand, come to me so we can have a conversation.
Dialogue.
Yes,
Absolutely.
we got to be able to have, and I don't care if it's vitamins. I need you to write down what this
Right.
vitamin is.
Absolutely.
It's not just a
Absolutely.
job. It's not just a
hmm
job. We are taking
You're
care
not a
of human
test nurse.
beings. Yeah.
hmm
Yes.
Absolutely. And I tell them to treat those patients like they're your family member. How would you,
Yeah.
or if it was you laying in that bed, how would you want to be treated if that was your
Yes.
mom, dad, your baby that was laying in that bed?
Yeah. Yeah. Same. And I tell myself, even if you don't too much care about your mama, how would you want to
Right.
be treated
Absolutely.
if it
Or if
was
it's you
you?
in a hospital,
Yeah.
absolutely. How do you want to be treated when you're not feeling well? And when I love getting those aha moments when a light bulb goes off with the
Yes.
students, or bringing in life experiences. Like my
Mm-hmm.
father-in-law passed away in November and he had Alzheimer's. So it was very triggering for me to go to the hospital and be with the students because we had patients that resembled. We actually had a
Mm,
patient that almost mimicked what was going on with my father-in-law, and they were
mm-hmm.
just like, "Well, I didn't." The family was refusing some kind of care, and I was like, "I don't understand why they want to do that." And I utilized my own personal experience
Mm-hmm.
to kind of explain why families might do that, or might not want to do something just based on,
Yes.
but it was difficult in doing it. But I do like when they are able to see things from a different perspective.
Yes, yes. So even being a patient yourself or having that
Hmm.
patient experience, how does that affect you even going forward in your role as a advanced practitioner?
I am much more vigilant about listening to my patients and pulling back those layers to find out what's going on, why is this going on. If they said they're hurting, like, and not making assumptions. That is one big thing. Just not making assumptions about patients.
And I think a good rule of thumb with that is assess like a good dialogue as far as assessment. Like you have to
Hmm.
be able to talk to your patients, and a lot of time it's
Hmm.
not what the stethoscope shows tells you; it's
Absolutely.
what they say. And so
Absolutely.
I commend you for even taking on that role as an advanced practitioner
Thank you.
and all the other services that you provide as well at Rejuvenate
Thank
901.
you.
Yes.
Yeah.
With your experience, what advice do you have for young women, especially women of minority backgrounds?
What advice do I have is listen to your bodies,
Hmm.
and advocate for yourself. And if you cannot get the care that you feel like you should be receiving, or if you have healthcare professionals that aren't listening to you, go to another healthcare facility that you are going to receive the care that you deserve. Everyone deserves to be heard, and everyone deserves adequate healthcare. So just like I had to do, even though them knowing I was a nurse practitioner, that meant nothing.
Mm,
I had to leave and literally go across town to another facility, and I knew I should have went to that facility to begin with, but it was a longer drive, but it saved my life. So
got you.
listen to you, bring people with you to advocate for you if you can't,
Yes.
if you're struggling to do that yourself, or you're just not that type of person. But that's my thing, is making sure you speak up for yourself, listen to your body, take care of yourself. you
Hmm.
you you have a cup that you keep pouring into other people, but you can't keep depleting your cup to give to others. You have to have something for you, so that you're
Yes.
not ending up sick and not well. And it's okay to be selfish and caring for yourself.
Yes. And I see where you have helped to support Heart Month in
Hmm.
February,
Yes.
which is big because I think a lot of times people don't really get the gist of things until they hear numbers, until or
Absolutely.
until they hear statistics. And so I do have a couple of statistics here when
Okay.
it comes to just African Americans. And so, according to .gov, African Americans are twice as likely to have a stroke compared to people that are non-colored.
Hmm.
And then among African American women, the stroke death is approximately 106 per 100,000 population, whereas for non-Hispanic white women, it's around 77 per 100,000 population. And so that's a higher number, 106
Hmm.
compared to 77. And
Hmm.
then with even our black men are 70% more likely to die from a stroke than non-Hispanic white men. And so it definitely affects the African American community even.
Absolutely.
And so I think that
Absolutely.
that's just so important to advocate for ourselves. But on the front end, we also have to be healthy. But as you're the proof that you were perfectly healthy in your 30s and you
Hmm.
still had a stroke and you had
Hmm.
two. And your outcome is probably a lot better because you were healthy on the front end
Absolutely.
by the grace of God.
Absolutely.
And then I do want to share when we talk about stroke, because a lot of times people don't hear of it, especially when they're non medical, until they hear
Hmm.
that a loved one has had a stroke. And
Mhm.
so I do want to share just the basic signs and symptoms of stroke when they use the acronym B FAST. B
Mhm.
for balance, if a person's balance is off. E
Mhm.
for eyes, if your vision is off. And
Mhm.
then fast. F is for face, right? Facial drooping. A is for arms. If you can hold both arms out and one is drifting downward, you can just tell there's obvious weakness on one side. Am I
Yeah.
explaining that in a way
Correct.
that you
Mhm.
think you can pick it up? Okay. And then
Absolutely.
S is for speech.
Mhm.
If someone's speech is off, and it may not just be garbled, it may not be garbled speech, but if they're trying to tell you to throw the trash away, but they're saying throw the trash in the refrigerator, like, and it's just not
Mhm.
making sense, then that could be signs
Absolutely.
and symptoms of a stroke as well. And then T, we have to think of time, because time is of
Mhm.
the essence, because we think of it like a brain attack, like there's something going
Yep.
on in the brain that we have to get them medical emergency as soon as possible to
Absolutely.
a stroke certified center. And a stroke
Mhm.
certified center is a center that can do a CAT scan on individuals that come there with signs and symptoms of stroke. So I did
Mhm.
want to make sure I shared that with my listeners so that they will know, especially if you are non medical as a listener. Those are
Absolutely.
important things to know. Do you want to add
Absolutely.
anything to that, Dr.
I think you hit it on the head. Just keep up with your preventative wellness visits. You should be
Yes.
seeing a doctor at least once a year. And if you have high blood pressure, diabetes, high cholesterol, every 6 months. And just making sure you're staying up on your preventative wellness cares, the breast exams, the colonoscopies, if
Yes.
you're around those ages. But getting physicals and getting checked out, getting lab work done yearly or more
Mm-hmm.
frequently, depending on your medical history. With my weight loss that I do in my clinic, we draw labs, and we found a lot of our patients that are pre-diabetic, or in some of them were full-fledged diabetics and did not know it,
Wow.
because I was the first provider they had seen in years.
That's
And granted, even though
important.
I'm family practice, I don't really do primary care,
Mm-hmm.
but my due diligence in making sure patients are safe and cared for, I have to, you acknowledge that when you get those abnormal labs back
Right.
and do what you need to do to take care of that patient. But it just goes to show, like, there are people, and I don't know if COVID has something to do with it, but people um are not going to the doctors like they. So I
Mm-hmm.
recommend people, in addition to entering your lifestyle and getting that physical activity in 150 minutes per week, drinking
Mm-hmm.
water, incorporating those fruits and vegetables, and meditating, or finding something as a stress relief, whether it be your religion or whatever else you might find that's healthy
Mm-hmm.
lifestyle, to help you cope with the day to day of life, because life be life.
Yes. Yes. I think for me, of course, I do a daily devotion. And
Okay,
so
awesome.
that's my way of staying grounded. And then I used to do it more often. I used to love to
Okay.
do yoga, and I see that you were actually, fun fact, a yoga instructor.
I am, and we do a little cool yoga. I've slowed down on it, but I need to pick it back up again. Just my schedule is crazy. Yoga
Mm-hmm.
and CBD, which is really really fun. It's a yin yoga, which is really soothing. Um, Type of yoga that helps calm you down, and the CBD, of course, without the THC, and it helps with calming your nerves, help with stress relief. And a lot of times, after we have our sessions, people will text me and say I had the best sleep I've ever had, and because I do it
Wow.
at nighttime, 7:15 ish is the time that we usually have yoga sessions, and it's right at the CBD store in Collierville. It's called
Now,
Your CBD Store. Hmm.
your CBD store. Speaking of CBD and yoga, tell me more about your 929 apparel and Rejuvenate 901 clinic.
Okay. So 99 Apparel is actually my women's fitness clothing line.
Mm-hmm.
I'm a big yogi person. I love to do yoga, hot yoga specifically. And I was investing a lot of money into workout gear. I'm like, I might as well invest in myself, because if I look cute when I'm working out, it makes me want to work out more. So I created a clothing line The name 929 is actually my birthday, and 9 is a significant number. Those numbers are significant in my life. So those are like my angel numbers and my favorite numbers. And the logo is a heart, my favorite color, with the royal blue, and then the EKG tracing, which is significant of me being a stroke survivor. So
Oh, wow.
that's how I created that. But I wanted some affordable clothing for women to work out in and feel good in, and encourage them to work out. Rejuvenate 901, I was like, I need to stop investing into everyone else's business and invest into my own business. But that, in combination with being a stroke survivor and creating services that offer a holistic, more preventative type thing for patients and in the community, like IV hydration, the cryotherapy. I want to offer services that were more naturalistic, like the PRP services, the O shot, the P shot, vampire breast lift, things of that nature, and of course the weight loss as well. But things that can help people stay well and continue to live a quality of life.
Got you. Now, I know you do cryotherapy. Tell me a little bit about that.
Cryotherapy is basically, ours is mobile and it's targeted. So it's not the chamber that some people are used to, but cryo has been around for quite some time now. A lot of athletes do it, but it's not just for athletes. Cryotherapy can be utilized for skin tightening, for fat reduction, and also for the pain component. Ages 5 and up can utilize cryotherapy. Basically, it's cold therapy. Your body basically thermoregulates, and it reacts to the cold therapy in the way that it needs to, whether it be warding off inflammation and pain receptors, releasing those good endorphins so that you feel better after you've had the cryotherapy with the pain component. And then with the fat reduction component or skin tightening, it releases collagen to help tighten up the skin, make it look more youthful. And with the fat reduction, actually destroys and break down the fat cells, and you basically excrete that through your sweat, your urine, or your feces. So all of those can potentially require multiple sessions, and of course mixed with exercise and diet and eating right. Those work tremendously well for the cosmetic component. And with the pain component, it's just based on your body's way of healing. So if some people just require one session, like I have a son that plays football and he gets banged up pretty bad sometimes, so we definitely utilize it for him.
Okay, thank you for explaining that.
Absolutely.
Also, where is your clinic located?
We are currently located at 364 New Bahalia Road, right across from Target. We are under construction for a new location, still here in Collierville, Tennessee area. We're going to be located right by the Walmart in Collierville. So, as soon as we get clearance to get going, if you've ever done construction before in any capacity, whether it be for your home or business, all of those dates are all in the air until you really have a concrete. We're hoping and praying that we are done by the end of this month, and we am definitely by next month to get going, which is great because that's my birthday month. So that'll be a kind of good birthday present to start the month off with in a new location.
Okay. So with that, what advice would you have? Because I've also seen like more nurses try to go into the business route or the entrepreneurial route as well with their licensure. What advice would you give them?
For nursepreneurs, as we like to call ourselves, what I would recommend is finding something that you're passionate about. Don't find your own lane. Don't go with the status quo. Find things that you enjoy doing, things that you want to incorporate into your own clinic, and don't just look at what everyone else is doing. Do things that you enjoy and to set yourself apart. That would be my number one thing, to find things that you actually enjoy. That's literally what I've done when I created my services for my clinic. I picked things that I enjoyed doing, that I was doing for other people and making money for them, and figured out a way to do it for myself.
Oh, that's awesome. Thank you.
Absolutely.
Now, we have covered a lot in this episode, and I just really appreciate you, Dr. Ashanti Coleman, for even just giving me the time to be on this platform with me. And so what do you want the listeners to take away from this episode?
So first of all, thank you for having me on this platform and being able to voice my opinion and my experiences that I've had, not just as a provider, but also as a patient. But what I would like, my takeaways would be to advocate for yourself. not just for your patients and for yourself. If you've ever been on the other end of things where you were a patient and provider as well, it just gives you a better understanding of how healthcare should be. So advocate for yourself and your patients, your family, friends. If something doesn't seem right or doesn't feel right, seek out another provider. You're paying good money for your health care, and you should be comfortable with the provider that's providing that care for you, or the healthcare facility. Seek another healthcare facility out if you have to. With my mixed diagnosis, that's exactly what I had to do. And had I not done that, I probably would not be here speaking with you today. So advocating for yourself, invest in your health. Invest in your health, because what you're doing now is gonna show later on down the road. You're not gonna be in your 20s and 30s forever. You want quality of life. You want to be able to do things with yourself that you were doing in your 20s. You want to continue to still have a good quality of life. So I would say invest in your health. Your health is your wealth, and make your health a priority. Prioritize yourself over everything. Honestly, in some instances you do have to be selfish, and that's okay.
I think I can't see her name. Ayana Van Zant. She says selfish is really self-full sometimes.
Yeah,
like you're
absolutely.
not. Sometimes when you're selfish, you're really being self-full because
Absolutely.
you can't pour an empty cup. And so
you can't.
I think that's awesome. So as we wrap up this episode, how can others connect with you?
They can connect with me via Instagram. My Instagram is Rejuvenate 901 with the business. Coleman Empire is my personal Instagram page. Facebook is Ashanti Coleman, and on Facebook, Rejuvenate 901, the same.
Okay.
I also have Yogi Ashanti 929 for my 929 apparel. That's my other Instagram page as well. So any of those, the clinic, if you go to the website, rejuvenate901.com, you can send us contact information. We get back to people rather quickly. So I'll be looking forward to hearing from everybody.
Yes. And of course, you can find me or connect with me, your host, Nurse Chanel, at all1nurse_Chanel, SHENELL on Instagram, all1nurse on Facebook, and at all1nurse on TikTok. And I'm coming to YouTube soon. Yes, and you're also on TikTok.
Yes,
Ashanti.
Rejuvenate 901, and Ashanti, Dr. Ashanti on TikTok.
Okay. And then with your 929 apparel, do you also have specials sometimes?
We do. I do run specials, especially on September 29th. I heavily discount on that particular day. But the clothing is really, there's nothing over $70 on the page. I make it very affordable because I know I'm cheap and I know what I would like to spend. But it's high quality clothing. Absolutely.
Okay. Well, thank you so much.
Absolutely. Thank you.
To my listeners out there, until next time, let your light shine. And Dr. Ashanti Coleman, thank you.